Now it's time for tip-episodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
All right, everyone, welcome into this week's episode. We have a new guest on. Stephanie, welcome to the show.
Thank you. Happy to be here.
No, you're not. You're not happy to be here. Yeah, okay. But I'm grateful that you're trying to overcome all of your dislike of your own voice and nervousness to be here. So
Thank you.
we do have a great message. I think we were talking yesterday about this. I think it's going to hit home with a lot of people because when you were talking about it, I actually couldn't relate. But then I told Jackie what you had said, and Jackie's like, oh, I didn't think about that. You're right. I didn't think about it that way. So before we get to that, though, do you mind just telling the listeners a little bit about yourself, like who you are, where you're coming from, like what's your journey been like?
Yeah, absolutely. So, again, my name is Stephanie. I am an RDH, and I had a career before I became a hygienist. So I was in retail, managing retail stores for 10 years.
Me too.
Awesome.
I mean, we
Retail
talk about
rocks
that. Retail
until
does
it's
rock.
Christmas.
Oh.
I mean, Christmas is awesome until you work
Until you're in
Christmas.
retail.
Yeah.
Oh, yes. Okay.
Yeah,
We'll talk
so-
about that more off the podcast. That's great news.
Yeah, so then I had a family and I decided I didn't want to work holidays and weekends
Mhm.
and wanted a new career. I got super inspired by an acquaintance of mine, Brittany Seymour. She now works at Harvard in
Shout out to
global
Brittany.
health. Hi, Brittany. She was a dentist in Denver at the time, owned her own practice, and we were great friends. And she really got me interested in dental as a career option and as a whole health practice
Mhm.
and where I could go with it. She did a lot of work in Haiti, and she just really inspired me. So I went to hygiene school and was super dedicated. You wouldn't meet a bigger diehard for this profession.
Were you the Golden Scalar Award winner?
I,
Were you that good?
I was good. I
Okay.
was committed. I was in it to win it.
Okay.
And so excited about my future. And still love dentistry and teeth and everything it comes with it. So
Well, that's good because I feel like that's where a lot of us start.
yes.
But your pathway for what the future holds is different. I hear a lot in the Facebook groups. Look, I'm so tired of dentistry. I just want to get out. I'm tired of patients. I'm tired of this. I want to leave. That's not what I'm hearing from you. You still love dentistry,
Yes.
but clinical practice isn't really in the cards for you anymore.
Correct.
How do you feel about that?
a health situation that detoured me out of the clinic before I felt like it was my time.
Hmm.
And it was very devastating for me because I put a lot of work, as all of us do, into this career. I believe in it still. I believe in the good it does. And I think having been forced out of it for something like that just felt like a huge loss for me. So yeah, I think it took me a long time to get to where I am. And anyone who might be experiencing something like that, I encourage you to reach out to your peers because there are other things in your future, but it just didn't feel that way. It felt like a loss of my identity.
So how long would you say that you felt like that loss of identity, I guess, until you like, look, there are other options for me before you kind of like started like, putting yourself out there a little bit more?
Way too long.
Which is a
Over
common answer.
7 years
Really?
that I really battled wanting to go back and really trying to get my health to a point where I could go back. It was always my mission. I need to get well enough to go back.
Yeah.
I didn't do all this for nothing. I didn't,
Mhm.
This is what I meant for. And yeah, I think I really wanted it as who I was.
But I feel like you're so hell bent on clinical being where you had to go back to. Like, why was that the mindset?
I think that's where I felt like I could do the most good for others. I felt purposeful. I
Mhm.
felt like I had meaning there, and I felt that elsewhere didn't. I think because I got out of retail because
Mhm.
it didn't feel meaningful to me, and I wanted meaning, and that's what I was searching. And I thought patient base is the only option for that kind of reward.
Sure.
And if anybody out there, if this is resonating with you, I totally get you. And it isn't true. I found amazing meaning and purpose and home in dentistry still, connecting the two pieces of my life back together and really, worlds colliding kind of a situation, but it really took the grieving process and a reach out for that to happen for me. And yeah, it was sort of magical.
So I want this to be like the tip that we're focusing on, because that transition, what were some of those steps that had to happen? Either you reached out or someone else reached out to help you see that next step.
It took one act of courage, honestly, to start the ball. One big leap of reaching out to a connection and being brave and saying, hey, I need help. I'm ready to do something. And I know you know some folks in the dental world outside of my world, and I would really love some help connecting and seeing what's out there for me. And it was hard.
I was going to ask, how long did it take you to get that courage?
Oh gosh, a few months.
Really?
That once I knew I wanted to do it, it took a few months of like, okay, how am I going to make this call? You know, how's it going to go? Am I going to be okay with the outcome of this call regardless of how
Sure.
it goes? And then like, what's the anticipation and my timeline and my expectation after the call? And I really just wanted to set myself up, you know, for disappointment almost.
Sure.
Because I was scared, but I also wanted to respect this person and their connections and not feel like I was putting everything on them. Which, you know, when you're the person making the connections, that's never how you feel. You like can't wait to like get out there and support your person. But I didn't realize that. You're so in the dark, and I was so insecure with my skills, having been outside of the world of dentistry for so long. But my passion for it is still so strong. So I really wanted it. So I ended up making the call.
Did you feel like before making the call, it's because you're an introverted person and you didn't want to make that part of the call? Or was it really kind of what you were saying, because you didn't feel prepared to be able to take the next step?
I think it was more the latter. I think I really wanted, if I'm putting myself out there, I wanted to be able to perform what I'm offering. I never let anybody down. I want to be able to do what I'm doing. And also whoever that person was going to connect me with, I'm representing, you know, my connection as well, not just myself. So
you put a lot of thought into this.
They're putting themselves out there. I'm putting myself out there, you know, and I wanted to really make sure that all of those pieces were respected. So
let's talk about like the reception of, you made that call. How were you received by that person that you were connected to?
Oh, they were over the moon. Like, so happy I reached out.
Yeah.
And happy I was doing well enough to move forward. Because I think, you know, all of the people in your life want you to be doing well. And so that was also something I didn't expect, was the cheerleading part.
And then the subsequent people that you've talked to since then, how is that reception? Have you met any obstacles that you thought you were going to meet?
No, I set myself up for so many things I didn't need to. The dental community is an amazing group of folks, which I always knew, but just the support and the outrageous, you know, like I said, cheerleading of, hey, this person has gone through something and we're here to pick her up and move her forward, because dentistry is where it's at. So that's where our people live. And that's part of the identity piece that I was missing so much, and getting back in and meeting these people and chatting with everybody. It just is so rewarding and fulfilling in a completely different way than clinical ever was. And I just feel like there's so many more options and avenues that really still integrate you with that world. And I felt excluded, but it was because I chose to see it so narrowly.
We're not going to improve upon that. So listeners, this is a common thing. This is something that happens a lot. If you are feeling burnt out, if you're feeling any sort of, this isn't for me anymore, don't necessarily look outside of our profession. Look at other alternatives. If someone wanted to reach out to you and ask you more about maybe your journey or thoughts, are you open to emails or anything?
Sure.
What's a good email address for you?
I'm at products at Dental Hygiene Nation.
I love it.
So Dental Hygiene Nation, people, come check us out.
All right. Thank you very much for being here.
Thanks. Bye-bye.
A tale of two hygienists.